For the facelift operation, we identify the surgery based on the patient's examination findings. First of all, if the patient's examination findings indicate that a full facelift surgery is required, meaning both the mid-face segment, the lower eyelid and the upper eyelid, if the lower part of the face and the neck also need to be tightened, we make an incision starting from in front of the ear and curving towards the back of the ear. In this case, especially, this is the chart I commonly present to my patients. After separating the skin from the underlying tissues, there is a very thin layer of muscle tissue called the SMAS. If we perform the lifting techniques on this layer, if we implement a dual plane lifting approach, this facelift can rejuvenate the patient by 10 years, 15 years, and at times even 20 years, and the durability of this procedure is exceptionally long. The first essential point to consider in facelift surgery, I think, is this: we must absolutely apply SMAS techniques. The second point we need to be cautious about is that we must be very alert regarding the facial nerves. The facial nerves in our face are positioned at the level of our earlobe. It emerges from the skull and functions as a branch, enabling all the facial movements roughly resembling 5 fingers. It gives its branches. We must be very careful with the facial nerves, especially during this surgery. Even a small touch to the facial nerves might result in temporary facial paralysis. However, we, who are very familiar with facial anatomy, work very carefully, especially regarding these injuries. After completing our lifting procedure, especially those related to the SMAS, we seal the cuts with aesthetic, concealed, self-dissolving stitches beneath the skin. If the patient has no existing health problems, we insert a small drain in the surgical site to avoid any blood accumulation. And we drain any blood that may accumulate outside. And once we finish our surgery, we apply bandages to the face, using small bandages, and then place a facelift mask over it. The patient only needs to stay 1 night in the hospital after the operation. They can be discharged easily the next day. Typically, it takes approximately 7 to 10 days for any swelling or potential bruising in the surgical area of the face to go down. We need time. After this 7 to 10 day period, the patient can comfortably return to their social and work life. They can come back with a fresh, taut and youthful appearance. The outcomes of these surgeries are superb and natural. Because when we examine this from the perspective of a vector, given that our primary vector is directed upwards, and we are applying a stretching transformation using an oblique vector under all circumstances, in an average surgery of 4 to 5 hours, the aesthetic outcome is excellent. We can have a natural looking face, skin and overall appearance.